tuberculosis, TB, its causes, symptoms, treatment, and precaution. Welcome to WA Health and Care, your trusted source for health awareness in the UK and USA. Today, we're discussing tuberculosis, TB, its causes, symptoms, treatment, and precautions. Understanding TB is essential for prevention, early detection, and protection of yourself and your loved ones. Stay with us to learn more. 1. What is tuberculosis, TB? Tuberculosis, or TB, is a serious infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs, but it can also spread to other parts of the body such as the kidneys, spine, and brain. According to Dr. Anthony Fauci, TB remains one of the top infectious killers globally, and awareness is key to prevention and early treatment. TB spreads through the air when a person with active TB coughs, sneezes, or speaks. Unlike some infections, TB doesn't always cause immediate symptoms, which is why it is often called a silent infection in its early stages. People with latent TB carry the bacteria but do not feel sick and cannot spread it, whereas active TB can make a person very ill and contagious. Common symptoms of active TB include persistent cough, sometimes with blood, chest pain, fatigue, unexplained weight loss, night sweats, and fever. Early detection is critical, as untreated TB can severely damage the lungs and other organs. Treatment involves a course of antibiotics over several months, usually 6 to 9 months, to fully eliminate the bacteria. At WA Health and Care, we also emphasize the importance of maintaining a healthy diet, staying physically active, and supporting the immune system during treatment. Preventive measures include avoiding close contact with active TB patients, wearing masks in high-risk areas, and vaccination with the BCG vaccine in certain countries. TB can be fully cured if detected and treated properly. Awareness, early testing, and adherence to treatment are vital. At WA Health and Care, we encourage viewers to stay informed and take precautions, because prevention and early care save lives. 2. What are the causes of tuberculosis, TB? Tuberculosis, or TB, is an infectious disease caused by the bacterium Mycobacterium tuberculosis. It mainly affects the lungs but can spread to other organs such as the kidneys, spine, or brain. According to Dr. Anthony Fauci, TB occurs when the bacteria are inhaled and settle in the lungs, where they can remain dormant or develop into active disease depending on the body's immune strength. The most direct cause of TB is close contact with someone who has active TB. The bacteria are airborne and can spread when an infected person coughs, sneezes, or even talks. People in crowded environments, healthcare workers, or family members of TB patients are at higher risk. A weakened immune system is a major factor that allows latent TB to become active. Conditions like HIV, AIDS, diabetes, malnutrition, or use of immunosuppressive drugs make the body less capable of fighting the infection. Lifestyle factors, such as poor diet, smoking, and chronic stress, can further reduce immunity. Environmental and social factors also contribute. Overcrowded homes, poor ventilation, limited healthcare access, and travel to high TB regions increase the likelihood of infection. At WA Health and Care, we emphasize that understanding TB's causes is key to prevention. Avoiding close exposure to active TB cases, maintaining a strong immune system through diet and exercise, and following vaccination recommendations can significantly lower risk. In short, TB arises from bacterial exposure, immune vulnerability, and environmental conditions. Awareness and preventive measures are essential to protect yourself and your community. 3. What are the symptoms of tuberculosis, TB? Tuberculosis, or TB, is a serious infectious disease caused by Mycobacterium tuberculosis. According to Dr. Lisa Richardson, TB often begins quietly, and its symptoms may not appear until the disease is advanced, making awareness and early testing critical. The most common symptom is a persistent cough lasting more than 2 to 3 weeks. In some cases, the cough may produce blood or phlegm. Chest pain or discomfort is also common, especially during deep breathing or coughing. Fatigue and weakness are frequent, as the body's immune system works to fight the infection. People with TB may also experience unexplained weight loss, loss of appetite, or general malaise. Other key symptoms include fever, chills, and night sweats, which often occur repeatedly and can disrupt sleep. Some individuals may feel recurrent low-grade fevers or a sense of overall illness. While TB primarily affects the lungs, it can also target other parts of the body. This may cause symptoms specific to the affected organ, such as back pain if the spine is involved, or urinary problems if the kidneys are affected. At WA Health and Care, we stress that early detection is vital. Latent TB may not show any symptoms but can turn active if the immune system weakens. Anyone experiencing persistent cough, fever, or unexplained weight loss should seek medical evaluation promptly. Recognizing these early warning signs, combined with proper testing, allows for timely treatment and significantly improves recovery outcomes. Awareness, vigilance, and medical care are key to controlling TB and protecting your health. 4. Treatment of tuberculosis, TB. Tuberculosis, TB, is a serious but treatable infectious disease. According to Dr. Julie Grallo, timely treatment is essential to fully eradicate TB bacteria, prevent complications, and stop the spread to others. Treatment combines medical therapy with lifestyle support to promote recovery and strengthen the immune system. The primary treatment is a course of antibiotics, usually lasting 6 to 9 months, depending on the severity and type of TB. Common medications include isoniazid, rifampicin, pyrazinamide, and ethambutol, which must be taken exactly as prescribed to prevent drug resistance. Patients are closely monitored by healthcare professionals for side effects and treatment adherence. Alongside medical therapy, exercise is important. Light to moderate activity, such as walking, yoga, or stretching, helps improve lung function, reduces fatigue, and supports overall health. Nutrition also plays a key role in recovery. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and immune-boosting foods like garlic, turmeric, and berries can strengthen the body's defenses. Staying well hydrated is equally important to support lung and kidney function. Preventive measures are equally essential during treatment. Avoid close contact with uninfected individuals until the contagious phase ends, and maintain good hygiene and ventilation in living spaces. At WA Health and Care, we emphasize that TB is fully treatable with proper medication, lifestyle support, and medical guidance. Combining antibiotics, healthy diet, and regular exercise not only accelerates recovery but also helps prevent recurrence, ensuring long-term wellness. 5. What are the precautions for tuberculosis, TB? Tuberculosis, TB, is a contagious disease, but it is largely preventable when proper precautions are followed. According to Dr. Otis Brawley, awareness, vaccination, and reducing exposure to active TB cases are the most effective ways to prevent infection. At WA Health and Care, we focus on practical steps to protect yourself and your community. The first precaution is avoiding close contact with individuals who have active TB, especially in enclosed or poorly ventilated spaces. TB bacteria are airborne, so proper ventilation in homes and workplaces reduces the risk of inhaling infectious droplets. Wearing a mask in high-risk areas or crowded environments can also provide additional protection. Vaccination is another key preventive measure. The BCG vaccine, recommended in certain countries, can protect against severe forms of TB in children. Individuals traveling to or living in regions with high TB prevalence should consult their healthcare provider regarding vaccination. Maintaining a strong immune system is equally important. Eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains helps the body fight infections. Regular exercise and sufficient sleep also strengthen immunity, reducing the likelihood that latent TB will become active. Good hygiene practices, such as covering the mouth when coughing or sneezing and frequent hand washing, help limit the spread of TB bacteria. Regular medical checkups and TB screening are critical for early detection. Those at higher risk, such as healthcare workers, immunocompromised individuals, or people living in crowded conditions, should monitor their health closely and seek prompt medical evaluation if symptoms appear. By following these precautions, TB can be effectively prevented, ensuring both personal health and community safety. Awareness, vaccination, hygiene, and immune support are the pillars of TB prevention emphasized by WA Health and Care. At WA Health and Care, we emphasize that TB is preventable and treatable with awareness, timely medical care, and healthy habits. Stay vigilant, maintain immunity, and follow precautions. Now we'd love your input. Which health topic should we cover next? Heart disease, diabetes, or immunity boosting strategies?